Hello everyone. Today my topic of discussion will be on behavioral pediatrics. This is a subspecialty of pediatrics that focus on emotional, behavioral and developmental aspects of child health. It is a complex interplay between child's physical health, behavior and environment. So today we'll see what all topics are going to fall on this heading. If you have to define this behavioral disorders or behavioral pediatrics, it is pattern of disruptive, inappropriate behaviors lasting over 6 months. And this behavior should interfere with the learning, social interaction and emotional well-being of the child. And these are going to create family maladjustment, which is very stressful to the whole family. The child will have issues with siblings and with the parents in the relationships. So they face a very difficult time to adjust with each other. The causes for these behavioral disorders are 1. Overprotective parents and love expressed through money. These days parents have less of time, so they try to be more materialistic. So they give materialistic things like buying expensive clothes, expensive toys, branded electronics, try to give them more comfort, wealth, and then just give them status, and then give less of time and love. So the learning pattern is not correctly done. So this is one of the very major cause for this type of behavioral disorders. Another is high parental expectations and rejections. The parents have very high expectations for their children because these days they have just one child and they expect everything from that child. So one person cannot be 100% in everything. So they have a very high expectation. They expect the child to be always first in class. They expect their child to become a doctor or engineers and they hold a very high post, and they don't see what the child is interested in. And if the child is not doing good according to their wish, then there is rejection. So this is going to create the behavioral disorders. Another point is sibling rivalry and unfavorable criticism. So amongst the sibling, if the parents or the elders, they are doing comparison or criticism, saying this one is better than the other. So that sort of criticism is very unhealthy for the child. Or even in the school, if the student, the teacher is comparing or criticizing the good students amongst the weaker students, or good status amongst the poorer status. So all these criticisms are going to create this behavioral disorder. Another cause is broken family. So that is single parent family. And if there is a parental discord, that is disagreement, conflicts between the parents is going on every day. So there is no harmony in the environment at home. The child is only seeing fights or conflicts of the parents. So if it is like that, that also creates this behavioral disorder. Now, what factors are affecting this behavioral disorder? So one is genetic, heredity. So many conditions, disorders can be genetic, where the genetic pattern is playing role. Another is environment. So parenting styles of the parents and overall family environment is going to affect the behavior of the child. Another is learning and reinforcements. Learning and positive reinforcement influence the behavioral patterns. So there should always be positive reinforcement. Now come to the classification of this behavioral pediatrics. It is classified, the maximum place where they use the behavioral disorder is according to the classification of DSM-5. That means Diagnostic and Statistical Manual of Mental Disorder, 5th edition, given by American Psychiatric Association. So according to this, under this heading, there are many disorders, but I will be discussing only the disorders which are commonly seen in the pediatric age group. So number 1 is behavioral problems. So under this there are many problems, few I'll discuss today. Number 2, neurodevelopmental disorder. Number 3, disruption and conduct disorder. Number 4, emotional and social challenges. And number 5, regulatory disorders. So let's see the examples. Under behavioral problems, the conditions coming are number 1, pica, number 2, temper tantrum, number 3, breath holding spells. So these 3 I'll discuss today. And number 4, enuresis. Number 5, encropresis. Enuresis is bedwetting, encropresis is passing stool in inappropriate place. Neurodevelopmental disorders, ADHD, attention deficit hyperactive disorder. So here the child is in attention hyperactivity and impulsivity is seen, and then this affects the child's academic and social life. In detail I'll discuss in a separate lecture. Number 2, autism spectrum disorder is there. So here there is social interaction difficulties and repetitive behaviors. Number 3, learning disabilities, dyslexia and dyscalculia are the examples. Number 4, tics and Tourette syndrome, involuntary movements or vocalizations are there. Disruptive and impulse control disorders. So under this heading, oppositional defiant disorder comes. So here there is frequent temper loss and then defiance towards authority figure. The child is having very resistant attitude and then especially towards the rules and regulations. So they are disobedient to the adults and then to the rules. Another is conduct disorder. This is a very severe form of ODD. So here the child, it is severe and aggressive. The child is destructive. So there is property destruction, rule violation, there is lying, stealing. So all these aggressive actions are seen in conduct disorder. Then comes the emotional and social challenges. So here there can be anxiety disorder where there is excessive worry and symptomatic symptoms can be seen in a child in the form of headache and stomach ache. And number 2, mood disorders. So here the child is depressed and which presents with the sadness, withdrawal and irritability. And there are some other issues, school refusal and peer relationship problems are there. Excessive crying or screaming in a child can be seen. There are certain habit disorders like thumb sucking, nail biting, hair pulling, which is known as trichotillomania. So all these occurs to release the stress in an anxious child. So all these topics I will discuss in a separate class. Regulatory disorder, under this sleep problems come, which may be like night terrors, nightmares or difficulty falling asleep. So all these are sleep problems. There can be feeding issues in a child, challenges with appropriate eating behaviors where the mother and child goes on fighting. So this also I'll discuss later. And toilet training difficulties are there, delays or problems with the bladder and bowel control. So all this we'll see later. And for all this there are assessment and tools available to diagnose these conditions. So developmental screening can be done, behavioral checklist can be followed, and IQ testing to support clinical evaluation can be done. Management strategies for all these disorders is team based or it is multidisciplinary approach where the pediatricians play the main role because the child comes to the pediatrician first. So after the pediatrician diagnoses, then they can refer the child to different departments. So some major departments are psychologists, speech, psychiatric department, occupational therapist and social help workers are all required. And there should be an early diagnosis and then go with the behavior therapy, which is very important. And then parent management is very important. You should give training to the parents to handle that child because that child is different. And always family counseling is very important because all these conditions are benign many times. So that can be curable. So counseling is very important. Then after that you get supportive services by medication in some conditions, very severe conditions, and school is very important. So school support and individualized education plans should be done for that sort of children because those are special children. So school should also consider them. Another is community support services is required so that it will be comfortable for the child and the family to survive in that community. Now we'll start with the behavioral problems. I'll discuss 3 topics starting with pica. So pica means persistent eating of non-food items like soil, plaster, clay, charcoal, chalk, paper, hair, paint, wool, and then for at least 1 month in inappropriate for age, which is inappropriate for age. Pica is common in children up to 2 years. So till 2 years it is not a problem, but after 2 years if the child is continuing the same thing, then this becomes a problem. Then it is seen more in the lower socioeconomic class, and it can continue into adolescence and adulthood sometimes. Predisposing factors for pica is genetic predisposition, malnutrition including iron and zinc deficiencies. So many times iron supplementation is going to help or improve the pica. Poor parental supervision and neglect is another predisposing factor. Sometimes brain abnormalities like some hypothalamic defects or other brain malformations which leads to delayed motor and cognitive development. Child is mentally retarded, so child has a habit of eating up any non-edible substances. And then behavioral disorders can be the contributing risk factor, some other behavioral disorders, and family disorganization and instability is another predisposing factor for pica. The consequences or sequelae of pica can be, there can be risk of toxicity, infections and gastrointestinal ulcers by the different types of material the child is eating up. Lead poisoning is another big problem if the child is having a habit of eating up that pencil leads. And parasitic infestation can occur from soil ingestion because they start eating mud or soil, so that can lead to parasitic infestations. And there can be iron deficiency, anemia and zinc deficiency also. Treatment is a psychosocial approach. You should try to correct the underlying nutritional deficiency like iron or zinc deficiency. So you get supplement of iron or zinc, the child improves, and treat the sequelae if it is occurring, infections or infestations. If there is ulcer, so you need to treat accordingly and try to give nutritional education to the parents. Okay, now come to the second problem, that is a breath holding spell, which is seen in many babies, and then the parents don't know how to handle the child. So this is a reflexive event where there is a typical provocative event. Something is going to stimulate the child. The stimulus will be something the child is not wanting, unwanted things is present, which causes anger and frustration on the child, and the child starts crying, and the child cries so much that it stops at full expiration. Till then the child continues crying, so suddenly after that they become either apneic or blue. So the child becomes cyanosed or turns blue, or they become very pale, that is known as pallid. And during this episode there may be loss of consciousness, they lose muscle tone and they might fall down, mimicking seizure. And then sometimes due to hypoxia, intense crying, there is hypoxia or anoxia that may lead to, that anoxia is absence of oxygen, okay, so that leads to seizure. So that triggers the seizure. Types of breath holding spell, there are 2 types. One is cyanotic, one is pallid. So we have already seen in the previous slide. So cyanotic, in the cyanotic type, the trigger is anger, making the child angry and frustrated. And then here the child turns blue due to oxygen depletion during the breath hold, and then child may have convulsion. Pallid, here the trigger is fear or minor injury, so that leads the child to make cry, and the child at the end of the cry, child becomes pale over here, that is from the vagal response and brief apnea because of the fear. So the causes for breath holding spell is over pampered children, giving the child everything they want, child's attempt to control environment, and then the parents and caregivers, so they are trying to control everyone. The episode of breath holding spell is rare before 6 months, but sometimes it can be as early as 2 months. So that means they understand at this age also. Common is 6 month to 18 month age. Peak age is 2 years, and gradually it subsides by 6 years of age. Differential diagnosis for breath holding spell can be seizures, because when they're crying, at the spike of cry, they might have seizure. Since they turn blue, so cardiac arrhythmias or heart condition also comes as a differential diagnosis. Management. So before going to management, at least rule out the seizure and the heart disease. So do at least a echo and EEG. Rule out it is not a convulsion, it is not a heart disease or heart conditions. Then after that you become confirmed this is a breath holding spell, and you can do a blood test to check for the iron condition or hemoglobin status. Then you need to counsel the parents regarding the benign nature of this condition, that it is going to subside. And then another is pinching the child at the onset of the spell. So this does not mean you are going to pinch very hard. You just give a mild painful stimulus. So if you do that, it activates the reticular activating system and the autonomic system is activated. So that interrupts the reflex arc of the spell. So they return to the normal breathing, and that intense crying is not there. Another is not to exhibit undue concern. So many times just ignore and leave them alone. And then lastly, if they have a iron deficiency anemia, then you have to supplement iron for few months and the child will improve. So both pica and breath holding spell is related to iron deficiency. Now the third condition is temper tantrum. So this many of us had this when we were small, and then many children has this problem. So to define, this is a sudden emotional outburst in toddlers. So seen in toddlers, that is due to frustration or unmet needs. So they need something which the parents cannot afford or they don't give, so they become frustrated, and then they show these emotional outbreaks. They start crying and they just don't stop at the same spot, like they don't move, and they go on crying until they get the things they are demanding. So peak age for this is 1 to 4 years, and then gradually this subsides by 3 to 6 years of age. So the reason why it occurs is at 18 months to 3 years, and in their developmental life, they develop negativism or oppositionalism. So at this age, they just do the opposite things. You must have noticed children at certain age, whatever you tell them, they just do the opposite thing. So that is part of their development milestones. So during this age, they develop negativism and oppositionalism. So they are doing the opposite thing they are told. So also they develop at this age, they also develop autonomy. So that means they want to make their own decisions and want to become independent, but the parents are not willing to leave them. So 18 months, 3 years is quite a small age. So the adults, they don't leave them independent, but they want to become independent, act independently, make their own decisions. So here they try to separate from the primary caregivers, whether mother or other caregivers. So if they cannot do this, then the expression is anger and frustration. So they show all the physical aggressive behaviors like biting, crying, yelling, kicking, throwing objects to everyone, hitting, and then head banging. So all this they try to do. All these aggressive acts are shown it is seen in the temper tantrum. So here the treatment will be distract the child. Try to distract the child. Parents should be calm, loving, but firm. They should not let the child take advantage of their love and then loving nature. They should be firm enough also. So for gaining things, the child tries to take advantage, so that you should not let it happen. And many times best is to ignore. Just leave them alone, they'll become alright. And sometimes you can do time out procedures. So here what we do is keep the child alone in a safe quiet place for few minutes. 1 minute for each year. Suppose child is 1 year, just 1 minute. 2 year, 2 minutes. So that way whatever the child's age is, that minute duration you can keep the child alone. Maximum time you can keep them alone is 5 minutes, because otherwise they might injure themselves. So always try to protect them from injuring themselves. So be careful when you are doing the timeout procedure. Okay, thank you. So remaining behavioral disorders I'll discuss slowly in different classes. If you think my lectures are helping you, please subscribe, like and share. Thank you.